Hi everyone, my name is Shri Patel and I'm from India Home. Today, my colleagues and I will be discussing um, mitigating stigma and hesitancies related to COVID-19 and vaccines. I'd like to take a few moments to encourage everyone to write their name and organization in the chat. And if you're able to, please turn on your camera as we do have a discussion portion later in the webinar. So you just want to make sure everyone's engaged. So for our agenda today, we are first going to discuss some of the stigmas and hesitancies that RCHWs have seen on the field throughout the years. Then we're going to discuss some strategies that we implement. And lastly, we are going to talk about some strategies that we suggest, especially with CBOs and health departments working together. So I'm going to turn it over to my colleagues to introduce themselves, and then I'm going to reintroduce myself as well.
Hi everyone, my name is Dill. I'm the outreach supervisor here at India Home. I've been here for about 2 years and I will provide any insight throughout the webinar as needed.
Good afternoon, everyone. My name is Victoria. I'm a community health worker with India Home for a little bit over a year. I'm also a graduate student in an epidemiology program, and I work on the COVID-19 vaccine initiatives and will be presenting on stigmas and misconceptions regarding hesitancy as well as combating them.
So to reintroduce myself, I'm Shri Patel. I am a data analyst for India Home. I've been at India Home for about a year and a half, working on a lot of our COVID-related projects, especially the back end of them, the data, and reporting deliverables to those grants. And I'm also currently in graduate school to get a master's in public health. So I'm going to turn it over to Victoria for a majority of the rest of the presentation, where she is going to discuss some of the stigmas and hesitancies that she sees.
Thank you so much, Shri. So let's go ahead and get started. I do want to first talk about stigmas among diverse and immigrant communities in Queens. So the stigmas that we have most seen in general are regarding discrimination and racism, stigmas attached to positive COVID tests, and even stigmas related to the COVID-19 itself and their vaccines. I will start off by going over discrimination and racism. So in New York City, Asian hate crimes actually increased, which started to create fear. And that is the population that we work with the most. According to New York State Criminal Justice Research Report in 2021, the anti-Asian bias accounted for 42.7% of hate crimes incidents in New York City. And that's almost half. So that's a lot of hate crime going on. And undocumented individuals also fear seeking service due to their status. There are also stigmas attached to testing positive. Testing positive makes you seem untouchable, so to speak. By this, I mean people become isolated. They can't go to work, they can't make ends meet, and they can't interact with family or friends. You are in total isolation. So testing positive automatically seems like the end of the world. As far as stigmas attached to COVID-19 and its vaccines, the stigma attached to COVID-19 and its vaccines is actually influenced by the government's role in vaccine creation and virus origin. A lot of people question that. That was a hot topic of discussion. And an example would actually be, I don't know if anyone else remembers this, but I thought of this when working on the presentation when Donald Trump was president. He had called the coronavirus the China virus. So there's that stigma attached to where it came from, and how that potentially affects how it was spread. And I wanted to point out some of the COVID-19 stigmas throughout the year that we overall have to combat now every day. As far as stigmas and misconceptions in 2020, the most common heard or seen even on social media was intentional release and lab manipulation of COVID-19. Stigmas and misconceptions rather, sorry, in 2021 to 2022 was hearing that COVID-19 is not dangerous anymore. The fear had kind of gotten lost among the public. It was People were saying it was just like the flu and that natural remedies will cure symptoms. And the stigma overall undermines the impact of COVID-19. So that's when people weren't really understanding the impact of it anymore. In 2023 to 2024, which is present day, we see an increase in hesitancy of just overall accepting the COVID-19 vaccine info. And I would say this is thanks to previous years' stigmas and misconceptions. It all just came to a head. There's a stigma that pharmaceutical companies such as Pfizer are producing vaccines very quickly only for the money, not for the safety of individuals. And also the fact that the vaccines were forced in the past when there were mandates, and things like the J&J vaccine making people really sick contributed to the stigma that overall COVID-19 vaccines are perhaps a government tool and actually has no benefit. So after going over these stigmas and misconceptions, we can talk about how hesitancies are actually formed. So stigma leads to hesitancy and contributes to the perception that COVID-19 vaccines carry risk, carries negative consequences, and it makes it look overall ineffective. Hesitancies are also formed through a lack of untrustworthy COVID-19 vaccine info. People may not rely on incomplete or unreliable sources of info. They may go to that first. And hesitance also come from a place of uncertainty around the effectiveness and safety of the vaccine. There's also overall a lack of health literacy. And that means there's limited education on immunology, on how the vaccines work. And this is something that's been seen in community members that India Home works with. So they're more hesitant because they don't understand the information that's being presented. And after acknowledging how these hesitancies, are formed, we can examine the hesitancies faced by India Home in more depth. So I want to say we see a lot of hesitation around testing for the COVID-19 or for even reporting their at-home test results because of the implications, like I mentioned earlier. People realize they have to stay home for 5 to 10 days, and that can be a burden, potentially missing work and potentially missing income. Also today, some employers still may not even follow the state policy of 5 COVID-19 work days off for isolation. So community members are like, I don't want to tell people that I'm positive because no one understands or follows guidelines anymore. There's also hesitation around following COVID-19 vaccine recommendations, as well as its validity and effectiveness. The example that I want to use for that actually is the stigma influenced by the Johnson & Johnson vaccine. In the field, we heard a lot of people felt very ill from it, so people automatically assume that Pfizer and Moderna will also affect their health. So there's just a lot of talk going on around testing and a lot of talk going around the vaccines in general. People feel like the healthcare system has failed them. And in general, that is because some healthcare approaches have failed. There's also the existing healthcare disparities. People are hesitant to trust the healthcare system. That's just the reality of it, which makes it hard for people to accept the COVID-19 vaccine. We have actually seen inconsistencies with insurance costs covering the COVID-19 vaccines. It's been a lot of changing guidance. And our community members are already facing financial hardship. So it's already difficult to get people to want to take the vaccine when they're unsure of how much it costs or they're receiving a high copay for it. Another example, which I want to share, is a very strong example, but it definitely just goes to show what we're talking about is true. We were actually at a food pantry in a predominantly Black community in Queens, New York City. That's where India Home is at. We had a community member bring up the Tuskegee study when discussing why they didn't want to get a COVID-19 vaccine, why they refused to get any sort of like infectious disease vaccine in general. And I want to give context to this study. This study was back in 1932 when a part of the Department of Health in the United States Public Health Service tested on Black community members, and there was a lot of ethical violations. So, although the study itself wasn't related to vaccines, he brought it up to show that past system failures have lasting impacts. Because of this history, because maybe he had ancestors connected to this, he was unwilling to give us the time of day to even talk about COVID-19 vaccines. He automatically feels that the government has failed the Black community. So it was difficult to really try to explain to him why a COVID-19 vaccine will be effective. I actually also want to make a point that community members being hesitant also makes community workers hesitant to even want to address the topic. I just thought of that. But yes, thank you. So now I'm going to hand it over to Shri for brainstorming activity of what you would implement to mitigate these stigmas and these hesitancies.
Thank you so much, Victoria, for sharing those insights and touching on those difficult topics. We are going to create a brainstorming session here today. Please use the link in the chat, or you can go ahead and scan the QR code. In just a moment, I'm going to open up the poll and then reshare my screen. And we are going to discuss strategies that you may implement in order to mitigate these stigmas. It could be as short as something as social media campaigns or even something lengthier, but we just want to sort of talk through these ideas and discuss, based on our CHW's previous experiences, why this may or may not work. So I'm going to open the poll, stop sharing my screen, and then I'll reshare with the live answers. Okay, so the poll is now active. The link is included right here, as well as the QR code that was shown on the screen. So I'm going to reshare my screen again. All right, so the first one we have up here is education, which is a great sort of solution. I know India Home has been using educational sessions for at least a couple years now in order to mitigate COVID-19 related stigmas. Um, Initially, our educational sessions were, I know from the beginning of a project called the COVID Disparities Grant through New York Department of Health and Mental Hygiene. And a requirement of this grant, although it is mainly for outreach and COVID-19 information, disseminating that information to the public, it included hosting educational sessions. And India Home is also a center for for senior care. So we do have the ability and the staff um, to host educational sessions in-house, which is a great sort of method that we utilize so far. Further, we have addressing misinformation. This is a great way to mitigate stigmas by discussing these sort of issues to community members directly. Um, we're able to see that like stigmas stopped in place. I will share a infographic at the end of the webinar showing myths and facts, and like these myth buster situations have been very beneficial. Um, Next is more in-person communication on health information that goes hand in hand with sort of combating these stigmas to the community members themselves and combating these myths with credible sources um, in India Homes, infographics, flyers, or any sort of knowledge that is disseminated to community members. It is done with credible resources from the CDC, or even like other secondary resources like Mayo Clinic. Next, my interest lies in making sure health information is at a level for all readers. Health literacy seems to be a major factor in medical care. This is 100% valid and a great point to bring up. Health literacy is not the same across the board, especially in a diverse community like Queens. Um, Queens is an area where we have a lot of different cultures, educational levels, and income levels coming together. So it is really important to make sure that health information is easily understandable to all different types of education levels, even and like especially those who may have language barriers. A previous one of our webinars did focus on these language barriers and health literacy going hand in hand. So that is like something our community specifically has like a great deal of interest in. All right, creating a safe space for people experiencing stigma. This is extremely important because every community member's feelings are very valid. We want to make sure that we're just giving them the information that we have on hand, um, and try to get them to get vaccinated for the sake of public health. But we do have to understand where these stigmas are coming from. Like Victoria had mentioned, um, past experiences and mistrust in the healthcare system, like the Tuskegee experiment, really does create the stigma. So people do have a right to be worrisome and to be doubtful. Working with community boards or council members to have more health fairs in vulnerable populations. This is a great way to bridge the gap between CBOs who are working directly with community members, as well as health departments and local government who also have a great stake in public health within the community. Providing a mental health resources and support services for those experiencing stigma or discrimination in relation to COVID-19. I can say just from talking to our team that a lot of mental health and social services go hand in hand with the COVID disparities. Those who are impacted more greatly by COVID-19 and these stigmas and discriminations are disproportionately affected in regards to mental health resources and social services. So we do see these often go hand in hand. And as many of us know, COVID-19 really created a bigger disparity when it comes to this. When it comes to mental health resources, when it comes to social services, people were more financially impacted and they're still facing those repercussions from 2020. So it is important to provide these resources and social services so you can open up the conversation of COVID-19 stigmas, how we can combat them, what we can do to get our community members vaccinated. All right.
I definitely want to make a point, Shri, with making sure that mental health resources are available. Um, I think that what you said is very important. And I also want to highlight the fact that it did take a while for mental health resources to be more organized and efficient in a way where everyone would have access to it. I think a lot of people forget the pandemic happened during the winter time and people were isolated and couldn't come out in the spring. So seasonal depression was probably something that was very large. And people are like, why should I even take care of myself? That includes getting a vaccine, taking care of yourself physically, if mentally they're not feeling well.
And great point, Victoria. Like, thank you so much for those insights. I think it also goes hand in hand with the fact that people were isolated for so long. So that can create all sorts of different feelings, whether that be anger, mistrust, just general like worrisome for their own health and other people's health. It's really hard to take care of other people and get vaccinated for a community when you can barely take care of yourself. So it's really important to address these social determinants of health in order to sort of combat the stigma and discrimination related to COVID-19. So thank you for that. Does anyone have any more insights, any comments on any of the strategies listed here today? All of these are great. Thank you so much for your participation. Yep. Does anyone have any last comments before we come back together with the slides and Victoria will bring us through the rest of the presentation? All right. I will stop sharing my screen and reshare the slides in just a moment. Okay, can everyone see my screen? Just need a thumbs up.
Yes.
Okay, perfect.
All right, great. Thank you so much, Shri. So let's jump in to how we can combat these hesitancies, more rather, how India Home combats these hesitancies. So we do this through mitigating through COVID-19 fatigue, which is a lot of people are just tired of hearing about it, tired of talking about it. But we have to mitigate that because the reality is it's not in a place where it can just go away from a topic of discussion or concern. We also do this through interactive educational games, serving as a trusted messenger in the community, debunking myths, educational sessions, and providing services. So for the first strategy that I went a little bit more in depth in for mitigating COVID fatigue, I wanted to just explain what it was at first. As far as mitigating this, we provide our community members with a why. I feel like a lot of people during the pandemic didn't get a real reason as to why some of the mandates were in place. Although to us, it may seem easy to be like, oh yeah, that's we had to do this. To others, it may have not been a quick and easy solution, and it really interrupted a lot of people's way of life. So you have to give people a why. We also do like did you know facts because that's small, simple. On the field, we use talking points that vaccines kept coming out because of how strong COVID-19 is and because it saves hospital resources. So there's that why. And for the did you know facts on social media, India Home actually shares graphics with those kind of facts. We did it mostly with the bivalent booster because that was something we were trying to get our older adults to get a lot. And we were able to sneak in those facts with other health information that our older adults were interested in. For interactive educational games, this is actually one of my favorite strategies to use. So we developed two games that provide accurate information about COVID-19, about its transmission, preventive measures, and we also create the game to dispel myths and misconceptions. And the overall goal is just to foster a better understanding of the virus. So I remember in the activity, someone did mention providing more health literacy. The games is one of the ways we do that while dispelling myths. That's because our Jeopardy game includes true and false questions to help debunk those myths and stigmas. And the crossword puzzle helps us understand relative terms so they can understand information that's given. The games help India Home engage our COVID-19 fatigue in our older adults. And you can see here a good example. So a lot of people may not know why during the winter and fall, why there's a lot of vaccine initiatives. So in this example, the question would be the season where flu and COVID-19 spread the most. And you can see those answers are winter and fall. So this is what we had our older adults play. I would say it was very fun, very interactive. And then there's Jeopardy. So to demonstrate here, we are going to choose protecting health for 100. That's why it's highlighted. And when you click the question, you would try to say the answer. So you should do this activity for at least 20 seconds often. Wash your hands. You'd actually be surprised. I had someone say use hand sanitizer. And I was kind of just like, no, you wouldn't use hand sanitizer for 20 seconds exactly, but the actual activity, it's important to remind people of basic hygiene habits. That's a part of health literacy, I would consider. So we had other categories for vaccines as well for infections. So kind of like testing people. And some of these questions had myths in it, and they had to answer true and false to it. Thank you, Shri, for showing that. And the strategy of serving as a trusted community messenger. I would say we became a trusted community messenger by strengthening our connections with longstanding community partners. And these community partners that we work with have already established trust in the priority populations that we're trying to reach. So going to direct places of worships, like mosque are pillars in the community, especially here in Queens, in New York, and partnering with organizations, trustful people to provide vaccines to these areas are ways to basically engage trust. And of course, also having linguistically and culturally competent CHWs. Our last presentation, we actually had one of our staff members who creates a lot of our translated material speak on this. And she's pretty much a liaison. And I feel like that's important, of course, to gain trust. As far as debunking vaccine misconceptions and myths and in language, I kind of just did give a little preview to that. Like I said, our worker translates a lot of materials. One of the materials is one that we use to debunk misconceptions and myths. And we use it as we would say in language because it fits the target audience, which was our older adults. And this Q&A document was based off of our most asked questions from just in-person sessions and just from talking to our older adults. So that's how we were able to create commonly asked questions, which were their questions, and answer them from a community health worker's perspective, which was also providing public health information. And then we had it available in Bangla translation. So that's what I mean by providing in language, kind of trying to combat the misconceptions and myths that our older adults were facing. And also, India Home, we have found it helpful to have individuals we work with share individual experiences and testimonials. And this is through storytelling projects that are actually shared with the public. So if you were to go on our YouTube page or our Facebook page, you would see some testimonials from the people that we work with regarding some of our COVID-19 initiatives and how we have helped them in general. And another one of my favorite, because I run a lot of the educational sessions. So India Home has what we call education sessions. And pretty much what this is it's a session to try to just give public health information and get feedback from the community. And we tailor it to a specific audience. We like to recognize that one size does not fit all when talking to people, especially when providing public health info. Not everyone absorbs things at the same rate. So we have found it helpful just going to communities that are diverse in age and demographics. For example, our older adults or talking to parents, visiting different zip codes in Queens because the needs are different. And doing all of this definitely helps us combat these hesitancies. The example, which is why it says one of my favorites, is I like to hold educational sessions at schools and libraries, and we have them in live translations for Spanish and Bangla. So we bring the language to the session as well for community members. And services. As cliche as it may sound, providing things for community members does grab attention. But overall, India Home has found that this has been helpful just because after the federal emergency ended, or just in general, even before it, mask, test kit, sanitizers were scarce. They were also very expensive. So providing these materials for free and even providing food services that match different eating restrictions, halal, kosher, for example, vegetarian, meeting these eating restrictions encourage trust. People can trust us. They know that we're not going to make them sick. They know that we want to boost their hygiene, healthy habits to help prevent infection. So that's why I say providing services is a good way to combat misconceptions and myths because people are more likely to believe you if you're providing something that's really helpful to them. I've definitely done a lot of talking, but there are some key takeaways from the end of this presentation. And that is just some ways, based off the presentation, that community based organizations and Department of Health organizations can work better together to combat the stigmas because they're still here. This is year 4. I know we're not in the brunt of the pandemic anymore, but this work still exists because COVID-19 is still affecting our health. So it's important that CBOs and Department of Health continue to work together and combat the stigmas and make sure people have the information that they need to make the right healthy decisions. So some concrete examples of this is social media campaigns that are inclusive. What I mean by that is even having it in a different language. India Home posts some of our translation for social media graphics as well. Endorsing and promoting vaccine efforts consistently with community leaders. This could also include bringing the vaccine clinics to familiar spaces so community members are more likely to come to us. They don't feel like they have to do extra things on their part. Um, Even just going to the community, addressing the health literacy level, but also acknowledging individual experiences and definitely include those individual experiences in promotion efforts. And finally, of course, like I said, providing services that help provide some form of security. So that is some key takeaways. And I'm going to hand it back over to Shri. And Dil, if there are any questions in the chat, I want to thank you for taking the time to listening to me talk about this.
Thank you so much, Victoria. Does anyone have any final questions or any final thoughts? Anything they would like to share? I can't see the chat right now, so they'll let me know if there's anything in there. All right. There's no final questions. I want to just say thank you, everyone, for joining us here today. We really appreciate your time and participation in our third webinar in our series. We will send out a follow-up email with a copy of the slides, an infographic that our CHWs use as a myth buster, and finally, a copy of our brainstorming session. I've attached our emails on this slide here, so please feel free to email us at any time with any questions or concerns. We will be conducting another webinar on February 15th on incentivizing COVID-19 education sessions and vaccine uptake to increase willingness in learning and improve health outcomes in high-risk populations. So that is a very lengthy title, but there's a lot to cover within that next webinar. So if you wish to join us, the registration link will be included in the follow-up email. So thank you so much. Have a great day, and we really appreciate your time. Bye, everyone.
Bye, thank you. Feel free to email any feedback on this presentation as well.
Thank you.